Five, four, three, four, three, two, one. Hey everybody, how's everybody doing tonight? Welcome to another episode of Managing Money Matters because managing money matters. My name is Sean Bailey. I'm your financial lifestyle planner, and I'm truly excited about what we got going on tonight. But first and foremost, I want to tell you guys I appreciate you because you can be doing anything in the world tonight, but you are listening to me. And for that, I'm greatly appreciative, and I thank God for you. So I'm truly excited about tonight because I know you guys usually tune in and I talk about financial matters, whether it be managing your retirement account, um, managing the credit, whatever the case may be. But we also talk about a wealthy state of mind and being wealthy. And here's the thing, you cannot be wealthy without being healthy. So I'm truly excited tonight that my sister was able to grace me with her prince today because she's a very busy lady. So she took time out to talk to all the ladies today. So fellas, I'm sorry we're talking to just ladies tonight, but here's the thing. You need to tune in too so we can be aware of these things because I know a lot of brothers that love their wives, love their girlfriends and fiancés. And this is information that can be shared with everybody. Introduce to you guys my friend, my sister, Dr. Soyini Hawkins. Dr. Hawkins, how you doing this evening?
Hi, Sean. Thank you for having me. I'm doing great. Thank you so much for having me on your show.
Oh, it's my pleasure. Thank you.
I couldn't hear you. I think I just missed whatever you just said. Say it again for me.
Sorry, I was asking, how was your day today?
Oh, it was a great day today. I did a little bit of patient care. I did a little bit of going to the children's school to get ready for this back to school time of year. It was a good day.
It is.
It was a good day.
Back to school time, huh?
It is. It is.
I knew that because it took me almost 2 hours to get to work today, so I knew back to school was in session.
Oh, yeah. Wait till those buses really get on the road.
So I want to go ahead and get right into it because I think that you have a lot of great content to talk about, so I want to get down to it. Just tell the people, because I know how great of a person you are and how great of a woman you are and all your studies and things of that nature, but just tell everybody a little bit about yourself.
Thank you. So again, my name is Dr. Soyini Hawkins. I am a minimally invasive logical surgeon, and I have a private practice in Alpharetta, Georgia, just north of Atlanta. I obviously primarily focus on fibroids, given the name of my practice, Fibroid and Pelvic Wellness Center of Georgia. However, I also see patients for most benign gynecological issues, meaning non-cancerous gynecological issues, so ovarian cysts and endometriosis, chronic pelvic pain, again, fibroids and a lot of other dysfunctions, patients that have dysfunctional bleeding and might need surgical intervention. So I see a pretty full gamut of different gynecological conditions that need surgical attention.
Awesome. Okay. So tell us a little bit about your background. Like, where did you study at? Where are you from?
Sure. So I was born in Jamaica. Doesn't sound like it because I came here when I was 5. And both my parents went to Howard University. So I was actually raised right outside of D.C. in Maryland. And I was in Maryland for most of my early schooling, but then we traveled a lot. My mother changed jobs and got new positions and really chased her career goals. So we traveled a lot. I finished high school in Florida, and then I attended Xavier University in Louisiana, which is the #1 school for putting African Americans in medical school, but also just very well renowned and well respected. And I came to Atlanta and attended Morehouse School of Medicine and met my wonderful husband, fiance at the time. Moved to Maryland. I did my residency training at University of Maryland, and I did a fellowship in minimally invasive gynecological surgery at Mercy Medical Center in Baltimore. And now Atlanta's home. My husband wanted to come home to his mama, and I said, that's fine with me.
That's why now, for everybody that doesn't know, Dr. Soyini and Osei, who's our lovely husband, or her handsome husband that we're talking about are clients of mine, and me and Ote have a great relationship. And one of the things that we connect on is that we're some mama boys. We're some mama boys.
Yes, he is a mama's boy. But it's all right. I love his mama too. I love his mama too.
Ain't nothing wrong with it. Ain't nothing wrong with being a mama's boy.
Nothing wrong with it.
Yeah. So let's get into it, because you talked a lot about fibroids and invasive surgeries and things of that nature. What is your specialty? I know you talked about that, but let's go on a little bit in depth of what you specialize in.
Sure. So there are lots of different reasons that women will go to the doctor. Unfortunately, a lot of women, one, either don't go to the doctor and suffer in silence, or they go to the doctor just for routine things, but don't actually address some of their concerns and the ailments or issues that they might be having. Either they're embarrassed or they just think it's just something I've always dealt with. I've always been uncomfortable. I've always had heavy bleeding. I've never been comfortable with my intimacy and things like that. And so they just don't address it. So I'm that doctor that tries to get my patients to open up and discuss these things with me. And many people, by the time they seek me out, have either done so on their own or have been guided to me by their primary doctors because they need, and it's not always surgical intervention that they need. Don't always know that before they get to me. They just want to discuss what are their options. So even though I'm a surgeon and I love what I do, I love doing procedures and surgeries, more importantly, my goal that I do in being a physician is to empower women to just understand, know their body, and take care of it and live just very fulfilling lives and not suffer. So to be more specific to your question, I have a passion for fibroids, and therefore I offer a lot of interventions for fibroids. And again, not just surgery. We talk about lifestyle, we talk about health, we talk about, different medications that can be helpful to the patients. And of course, we also talk about removing fibroids and even going as far as doing a hysterectomy to remove a uterus for a woman who that might suit them best.
Okay. So, like you said, you had a passion and a desire to help people when it comes to fibroids. So because I think I heard about the subject and I heard you talk about it a little bit. Some women have fibroids or have the symptom of fibroids and don't even know it. Is that correct?
Yeah, absolutely. Absolutely. So fibroids actually affect 80% of women of every culture, every background, every ethnicity. It really can affect any woman. Fibroids themselves are benign tumors. So if you're asymptomatic, you don't necessarily have to do something about it. The difference is that some people are truly asymptomatic, like their fibroids are small, they're really not bothering them. They might find out about it on a pregnancy ultrasound, or a doctor might feel it on exam and say, oh, this is here, but it's not bothering me. You don't have to do anything because, again, they're tumors, yes, but they're, for the most part, benign tumors. However, when they become bothersome, a lot of times is based on where they're located, and if they get to a certain size, they can cause, the number one complaint most women have is heavy bleeding, heavy menstrual bleeding. And then number two, sometimes it's just like a bulk symptom. My abdomen looks larger, I look bloated, I look like I'm pregnant, or I'm having pressure on my bottom when I have to go number two, or if I want to urinate, I have pressure on my bladder. And these are vague symptoms that sometimes they'll ignore until someone says, well, yeah, uterus is kind of big, or, you may have fibroids, and then they associate, oh, it's the fibroids that's making me feel this way. They thought they were asymptomatic and they really weren't. So some women have it, a lot of women have it and don't know that they have it. Again, that's why I encourage women, talk to your doctors, tell them what you're feeling, tell them how you're feeling, and they should be able to enlighten you on what might be going on with your bodies. Because fibroids is something that's manageable. You don't have to, go to the bathroom every 20 minutes. You don't want to, because the fibroids definitely can be managed.
Like you said, some of this you talked about some of this that women can face. And again, guys, if you have questions or anything like that for Dr. Soyini, please just type them in and they'll pop up and she'll be able to answer them right away. But some people deal with the symptoms, but when people hear fibroids, the first thing they really think about is hysterectomy. Like, is that the end all be all? Like, if you have fibroids, automatically you need a hysterectomy?
No, absolutely not. And I've gotten a lot of patients in here more recently that have said, I've been to 3 doctors, and that is the only option they give me, and telling me I have to have my uterus taken out, and I don't want to. And some of them, it's not that they don't want to, but they just don't understand why. And they want to know, is that really my only option? Or is that, you know, the best option for me that's out there? And sometimes the answer is yes, even though, you know, I wholeheartedly, again, empowering my patients, want them to come to that decision and conclusion for themselves. I don't want to be that doctor that tells them you have no option but to take out your uterus. There's only 2 times that I might say, you know, honestly, this might be the best thing for you to do, and that's if I'm concerned that it might be cancer. And that's a lot more involved than just hysterectomy. Or if it's really, you know, impacting their other vital organs, and doing anything less might be too dangerous of a procedure. So, you know, when it comes to surgery, there are many options for managing fibroids or even dysfunctional bleeding, meaning heavy or painful menstrual cycles. Patients can get, at the very least, the uterine artery embolization, which isn't procedure, but it's minimally invasive. That's done by radiologists. I don't perform those procedures, but I encourage my patients, if it's something they're considering, they certainly can go see an interventional radiologist and have a consultation. Not everybody's a good candidate for it. I caution women that they can't think that everything's going to fit them. They have to know if they're good candidates for it. If their fibroids are too big or they have too many of them, uterine fibroid embolization actually can leave them in a worse state. Yes, the fibroids will shrink, their bleeding will decrease, but they can end up with a lot of pain. And I say that only because I've done surgery on many patients that have had that and have ended up in pain. However, it's a good option for many people. So they can always, you know, get a consultation and find out if they fit that box. But other surgeries like ablations for heavy bleeding saves people from hysterectomies. Not always a perfect option if you actually have a fibroid, because it complicates the picture again. But, you know, not everybody knows that that's an option to stop their heavy bleeding and take care of that dysfunction and that complaint that they have and keep their uterus. It saves a lot of women from hysterectomies. And then specifically when you talk about fibroids, most people are a decent candidate for what's called a myomectomy. A myomectomy is a much more involved procedure most of the times, because what we're doing is we're actually taking the fibroids out. So going in, cutting open the uterus, removing the fibroids, suturing up the uterus, and that's usually the best option for patients that want some future fertility or want to have children. But even for that patient that is done with childbearing and is saying, you know, I really don't want my uterus removed, I just want the fibroids get taken care of, they can still have that option to do so. Again, doesn't mean that's the, you know, in some people's opinion, the best surgery for them. If they're done with childbearing, the problem with just having the fibroids removed, most of the times they can grow back. 40% of fibroids can grow back within 5 years. So I do encourage my patients to weigh the pros and cons. You want to keep your uterus, but you don't want more children, and it's a possibility you can be back in the same situation in 5 years. And a myomectomy usually is a much more complicated procedure. Hysterectomy, if the fibroids are significant, sometimes can be a much more straightforward, meaning less blood loss, quicker recovery, less pain, and you're never ever gonna have a cycle again. Why wouldn't you want that? So I tell patients, no, hysterectomy is not your only option. Unfortunately, that's what a lot of women think. And I think it's up to physicians and clinicians to really educate their patients so they understand the difference from one to another and where the patient fits in, what actually makes them a good patient for that option. And then, of course, you know, the patient's goal has to be our goal. If at the end of the day she wants to keep her uterus but get rid of her problem, we still need to do our best to try to give her that, you know, being reasonable, of course, but give her that. And, you know, I'm going to say one more thing about that, because I feel like I'm dragging it on. When it comes to hysterectomies, I also find that a lot of women don't really understand what a hysterectomy is. So hysterectomy is only dealing with your uterus. It has nothing to do with your ovaries. Your ovaries are what keep you young and vibrant and are responsible for your hormones and, you know, will keep you out of menopause, keep your mood the same, not make your husband want to kill the doctor. You know, your ovaries are what you want to keep. And those are two separate things. Your fibroids here, your ovaries are here. Usually they're both not both the problem. So when you talk about getting your fibroids and your uterus removed for the sake of stopping your heavy bleeding, pain, and discomfort that the fibroids are causing, your ovaries usually are not a part of the issue and don't need to come with it. I actually encourage women that are younger than 65, even though average age of menopause is 51, so you would think, you know, if they're menopausal, maybe they'll want to take their ovaries. No. If they're 65, the literature now shows 65 and younger, it's actually prudent for them to keep their ovaries if they can, like meaning it's not infected, it's not diseased, there's no good reason to remove them, because even a little bit of estrogen that it releases, even in menopausal women, can be very beneficial for their cardiovascular, their heart health, and their bone health. So I usually encourage my women, my patients, to keep their ovaries. It's totally separate. They shouldn't change your sex life, your libido, all those things that women and their husbands or significant others get concerned about. Your uterus is not, you know, it's not going to change that. Your ovaries are what's important, so you keep those as long as you can. If you have ovarian cancer in your family, get rid of it. But if there's nothing wrong with it, just keep it.
And one of the things that I'm excited about having you on and why I think this is such an important topic, because I believe that from the information that I've learned and I've heard, so many women suffer in silence.
Right.
Like they just think it's just part, you know, a part of nature. And one of the things that is real to me is that, and the reason I remember this is I had a hysterectomy, and this was like in, I want to say the early 90s, like when it wasn't like like it was like full blown surgery, staples, and they cut her open, and I remember how much pain my mom was in, and I'm just thinking to myself, like, imagine if this education or this knowledge would have been around at an earlier date, she probably wouldn't have had to go through that. And how many times, just because I know in your practice you see it, and that's when people are coming to you. But I'm sure in your personal life, like how many women go through these things in silence? Like they don't just say anything. They just deal with the pain or suck it up. Because that's the one thing that I think is great about women. Like you guys do everything. You be in pain and all of that. And you just, everybody comes first.
Yeah.
You know what I mean? Like you have 2 children, right? Everybody comes before, you know, children and then the husband and then work. And then it's like, then you, so many women out there that just don't have, they think they don't have time or whatever the case may be. What do you say, like, what do you say to those women that feel like they're not paying attention to the symptoms?
Yeah. My mantra is kind of like yours. You can't be financially free and financially wealthy and financially empowered without taking care of you. And it's the whole you, which includes your health. So even though as women, you know, we put everybody first. It's in our nature. It's just really how we are built. That is how God created us as mothers, as natural mothers. We're caring, we're nurturing, and we want to take care of the ones that we love. And sometimes, you know, without taking care of ourselves, I see it a lot. And I tell women, you know, the best thing that you can do for your families, and most husbands would agree, is make sure that you're healthy enough to be around for them for as long as possible. That's, you know, at the end of the day, what they would probably wish for the women that are in their lives that they love. So not ignoring your discomforts, not ignoring your pain or ignoring, you know, the things that make you unhappy is important, because it fits into the bigger picture of just overall health and well-being. God has created us mightily and just beautifully, and he doesn't want us to suffer. He doesn't want us to be in agony, and certainly not to the, you know, to a fault to where everybody else is taken care of but ourselves. It doesn't fare us well in the end. So I feel like doing things like this, thank you for giving me a platform to just talk to women and reach out to them, and to the one that's not coming to my office, that doesn't know me or know about, you know, doctors like me that specialize in something that they might be going through. just to talk to them and tell them, speak up and definitely take care of yourself and seek it out. There are many doctors like myself that are passionate about not just this subject, but just women's health in general. Even if they can't feel like they can help you, they'll find somebody that can. Very important.
And you are, in my career, I focus and specialize with a lot of OBGYNs and their personal practices. And it's you and one other person, and I think you're aware of Dr. Jew, that out of all of them that I work with, you guys are probably the only two just like screaming it out, like, hey, we need to pay attention to this because, and I'm going to try to tie it in because I know a lot of fellows are like, okay, bro, you're getting a little deep with the women. We talk about some things and making me uncomfortable. But one of the things that I realized in listening to you and also listening to her is that it affects men to a point that it makes intimacy uncomfortable for women, correct? Fibroids can be uncomfortable when it comes to intimacy. Mm-hmm. So as brothers, we need to pay attention to some things. I'm just saying, we're going to keep it G-rated, but there's some things you got to pay attention to that you may think that she's not attracted to you or whatever the case may be, but it may be some things going on internally with her, correct?
Yeah, absolutely. I mean, on a personal note, I dealt with my fibroids and they came to light in my first year of marriage. I didn't think I was going to survive my first year of marriage because of the havoc that it was, creating for me, for my energy level. I was fatigued. I couldn't, pay attention to my new husband, and not even just on an intimate level. I couldn't be there for him, supporting him in what he was doing. You know what I mean? I couldn't give him my best because I didn't feel well all the time. And a lot of women say, my husband just doesn't understand. He might not understand physically what you're going through because, y'all don't ever want to know what menses feels like. However, put it on his level, kind of, make him understand what your desires are and that you just physically can't. And because of that, what you're saying is so true. It does affect men, and not just on an intimate level. I mean, I would get home from work and I would be so tired. I couldn't always cook a full meal or always, sit on the couch and sit up straight and watch a show. I'd fall asleep. And it was because it was my fibroids and the bleeding was taking everything from me. I bled more days in the month than I didn't. And my husband of less than 1 year had to be supportive and had to, love me because that's what he promised to do. And it was tough. It does affect everyone that you're around and that loves you. It does affect marriages. It does. It absolutely does. It's not just a woman's problem.
And I'm gonna tell you, just tonight, you kind of educated me because as men, we need to pay attention to those signs. Like you said, you're newly no energy, even though you're going to work and things of that nature. But there are signs that even as men, we can pick up on. I didn't even know that. Like you said, coming home, you don't have energy, and you'll just say, "Oh, well, she had a long day at work," or whatever the case may be. But it could be just something she's dealing with fibroids. Now, let me ask you a question: is fibroids hereditary?
It is. Very good, Sean. You own it. You just did your research. You did your homework. Yes, they are. We do see them in lineages. We do see mothers, and sometimes grandma had a hysterectomy. We don't know why. We don't. Again, because back in the day, nobody talked about this. Nobody talked about, what was going on with their bodies. They definitely hit it, but they know grandma had a hysterectomy when she was young at that because they was snatching out uteruses back then. So it definitely runs in the family. There's definitely a hereditary link. We don't know everything about fibroids, but we know that we do see it across lineages. And, we're born with the potential for fibroid cells. Most of the time we catch it when they're big and they're a problem, but fibroids take time to grow. They grow over years.
And what's funny about that when you talk about when mama and grandmama, like when my mother had hysterectomy, becoming a young kid, why is mother in the hospital? And then the thing about it was she was in the hospital for 6 days. Like she was in there for a long time, and I'm like, why is my mom in the hospital? Oh, she got female problems. I I just thank God that I'm a male. But you're right. At those days, there was no education. It was just, get a hysterectomy and you're done with it. And she made a choice. Well, I'm sure she was done with children. I hope because, I enjoyed being an only child. But, she made a choice. There was no education and there was no decisions. And I just think going back to what we were talking about when it comes to being healthy and wealthy, people think that my job is to make decisions for them. My job is to educate you enough to make an informed decision, and I think you have the same thing. Whether you can get a hysterectomy, but let me educate you enough that you know what's going on. The question I have is because I know there's some fellows listening. Do you have a lot of consultation where there's a husband and a wife where they make the decision together, or is it just a woman be like, okay, this is my body and I'm gonna do what I want to do?
No. Again, going back to what we said, this affects families. I have many husbands that, I'm here to support her because I see that she's uncomfortable, or, I can by pressing on the and again, because they care about that the final decision, is it going to be a hysterectomy? And I've found that be supportive in whatever their woman chooses to do. In fact, if our girlfriends that come in and see me in consultation, all take only their mama. All of us have people that we go. I still do it, and I'm a doctor. I pick up the phone. What do you think about this? When I get pediatrician, so I always give them information to family members because they're, somebody's gonna have to take care of them. A lot of times that decision has been prayed over, and we know as Christians, usually better when it's people praying over that thing. So most of the times it is will make with their loved ones, and I do get a lot of joint husbands and wives. I encourage it.
That is definitely awesome because, again, I think and we'll talk about it a little later, but there's a product, sanitary name, that I got involved with my wife because, again, I was like, it was something that made my wife better, and I'm very involved in that, in my wife's health. A lot of people think it's just because Darlene has sickle cell, and it's not. It's just because I care. You know what I mean? Like, again, I was a mama's boy, so I need somebody to kind of groom and take care of me. And look, this is the woman that I chose. I need her to be around for a long time. So I need to understand what's going on. Like, even when I tell people, I was like, I try not to talk in like doctor terms because I do. I talk to people like yourself and other doctors, and I'm like, yeah, Darlene had a sickle cell crisis, or her hemoglobin levels were kind of low. You're looking at me like, what? I'm like, oh, but I get involved in my wife's care, and if you care about you, is it like this? Come around with a pouch you want you. I think Darlene went and saw this video. You can simulating when men give birth, and I was like, yeah, I want parts of that. Everything is so. I think I need to pay more attention to that.
Funny, I've seen that.
Another thing I wanted to talk about, Dr. Soyini, a couple of months ago, you took a trip out of the country, correct?
Denmark with one of my. Can you hear me?
Yeah, I can hear you a little bit. Are you still there?
I'm here in Denmark, and back in what month was that? It was earlier in the year. My partner, my associates, and my husband. Fantastic trip. It's for work. absolutely a fantastic trip. I learned a lot. I saw a lot of very innovative. It was all together. Yeah.
Yeah, I can hear you.
Can you hear me?
Yeah, I can. Can you hear me?
A bit about the trip.
Just a little bit.
Okay.
Yeah, I hear you about the trip. I'm sorry.
Yeah. So I was going to talk about the Denmark trip. So I am in a practice with Dr. John Miklos and Dr. Robert Moore. They are world-renowned urogynecologists. So pelvic floor surgeons. They deal with prolapse and issues of the bladder and incontinence and just pelvic reconstruction. They also do cosmetic surgery, so they do like labiaplasties and vaginal rejuvenation and things like that. And Dr. John Miklos and I went to Denmark to learn about a new subspecialty called neuropelviology. And basically what that is a study of the nerves of the pelvis and how they affect function. So they affect our bladder function, they affect our our pelvic floor function. They cause pain if there's something that has either been done to them or something that has gone wrong with them. So we went over there and we are part of International Society called ISON, International Society of Neuropelviology, which I am the only woman to be a member of currently, and the youngest member that, but very excited to just be amongst a group of just literally world-renowned, awesome, outstanding, phenomenal, just ridiculously intelligent and groundbreaking physicians. I'm privileged to be a part of that.
I don't mean to cut you off now. How many people are part of this group that you're talking about?
So we have now inducted. It's in the 20s. It's a new, it's a baby. We're a baby. It's about, I think, 28, maybe almost 30 of us now, and we're growing constantly. What's that?
Woman, right?
I'm the first woman.
First woman.
I'm the first woman and the youngest member.
I'm proud of you, man.
Thank you. Thank you. But hopefully not the last. Hopefully not the last. This is something I think, honestly, at least the basics of it, every gynecologist, every urologist, every pelvic floor specialist and pain specialist should know about. I mean, it's not you can't just be inducted. You have to pass a test and you have to take a course and you have to become proficient at some basic skills, but it definitely is something I think that will really spread rapidly across the world. I mean, it's doing great things. We watched Dr. Passover do this procedure on paraplegics and literally make them walk. Within a year of surgery, with physical therapy and diligence, make the patients get up and walk. I mean, just outstanding, tremendously important work.
Awesome. So people are paralyzed,
Mm-hmm.
able to get legs and walk again.
Yeah. I mean, amazing. Through laparoscopy. So I'm a minimally invasive surgeon, and what that means is that most, I would say 90 to 95% of the surgeries that I do are done laparoscopically. So even some things that some general gynecologists might do open or with cesarean sections, like how you were saying that your mom probably had a big procedure and a big incision. I do them through tiny incisions. I do them through about a 1 centimeter or half a centimeter incision on the abdomen, and work that way, either through what we call straight stick laparoscopy, which is old school and just a good old fashioned way of doing it. Very straightforward, but it takes a lot of surgical skills and training, or with the advent of the robot, which a lot of people have heard of. So there in Denmark, that is how they were doing these surgeries. They were placing leads on spinal nerves to make these patients walk. Here, that's not what I plan on doing with it. Here, Dr. Miklos and I are actually going to be helping women who suffer from pelvic pain for a number of different reasons, but usually more so for maybe something that was done in a previous surgery that left them in pain.
Okay. So with that being said, because you've been giving the people a lot of powerful information. Again, everybody, we're sharing this to a lot of groups. If you have questions, please ask Dr. Soyini. But if they don't ask a question today, if people want to more reach out to you, Dr. Soyini, tell people how they can find you.
Sure. So the name of my practice is Fibroid and Pelvic Wellness Center of Georgia, but that's long, right? So if you just go to getfibroidhelp.com, it will actually link you to my website. And I have people that follow me on Facebook, and I try my best, just like these type of platforms and endeavors, to post educational material for patients and for people that are just curious. So if you also link me on my Facebook page, Fibroid and Pelvic Wellness, you'll be directly connected to me. And if there's anybody that wants to come in for a consultation, my office number is 770-475-4499. And then again, remember, getfibroidhelp.com. It's an easy thing to remember, easy way to get in contact and touch with me. And I take care of fibroids, I take care of endometriosis, pelvic pain, I do hormone therapy, I do pellet placement, I take care of incontinence, prolapse, I do a lot of different things in my practice. Most benign gynecological conditions, if there's some type of intervention needed, I usually can be helpful for patients.
And there's one thing you said, and I'm familiar with this, so I do want to let you touch on a little bit. One of the things you said, you do pellet placements.
Yes, I do.
Just females, or you do them on males as well?
Right now, I just do them on females, but there are other local doctors that do it on males. And we may, at some point, have a provider in our practice that does it on both, because I have female patients who's like, could you please help my husband? So at some point, we might actually branch out and start to do that.
Okay, so real briefly, we're coming to a wrap up because you've given some great information. But talk a little bit about the pellets. How do the pellets help your female clients, your patients?
Yeah, absolutely. So pellet therapy and hormone replacement therapy with bioidentical hormones, meaning the actual chemical makeup of the hormone is the same as what your body naturally produces, is a way for us to treat women, mostly postmenopausal women, but even some other conditions, but mostly postmenopausal women who have felt the effects of menopause. So they have hot flashes, night sweats, mood changes, decreased libido, which is a very, very big topic and a big one that a lot of patients come in interested in hormone replacement therapy. And the pellet has been around for a very long time, and again, has even been used in other countries much longer than it has been here. But I would say it's probably the newest out there way to get the hormone therapy to patients. And what pellets are the bioidentical hormones that are compounded into small, probably about 2 or 3 grains of rice size pellets, bigger for men, that's placed in the fatty tissue. So basically, it's placed with a very painless procedure into that area, and it sticks around for 12 weeks. And just every time the heart pumps, every time the blood flows, they get a little bit of that hormone therapy that, again, just refreshes them. It gives them a sense of well-being. It increases their libido. It takes away the hot flashes and night sweats. It depends on what the patient, again, symptoms, what they're looking for, what their goal is. And we formulate a program that can help them based on that, based on labs and based on their symptoms. But pellets patients have taken to it like wildfire. I dare to say that some patients are truly addicted to it because it's life-changing. It helps them tremendously.
I definitely imagine. That's why I said when you said pellets, it kind of rang with me because I've heard about them and I've done a little study on them, and I know they're great for not just women but men as well.
Absolutely, men as well.
Awesome. So now one thing and this is the thing, you did a great job explaining that. Because when I heard pellets, it was like pellets. I'm like, wait, isn't that something that you feed hamsters or something like that? But it is a very, very intrusive surgery. Well, not even surgery, procedure. It's not even
No, it's a procedure, yeah. It takes 10 minutes and it doesn't hurt. Yeah.
Yeah, see, but as big as I am, and you see how big I am, so it's a needle. I don't do needles.
It doesn't hurt. When I do it, patients are like, "Are you done?" It doesn't hurt, but
but you don't do guys yet, so we ain't even worried about that. My skin might be thick or something. You know what I mean? So like something could happen where I'm gonna be like, "Ow!" Now I'm a big punk in front of you, and every time I look at you, you're gonna be looking at me like, I can't go that route. You know what I mean? I want to keep the respect between us. But no, this is a great topic, and I appreciate you sharing this with us because here's the thing, guys. You cannot have true financial wealth because wealth is happy, right? So imagine you have all of this money, you worked hard, you built your money, you invested your money right, but you're miserable in everything you do because you're in pain or you have things going on. Or like you said, your marriage isn't right because you're uncomfortable, you're tired. You really need to sit down, and if you're not talking to Dr. Soyini, you need to be talking to somebody like her. And I prefer you go and talk to Dr. Soyini because one of the reasons I know I want you to talk to her is not because I'm trying to draw business to her. I know she's going to sit down and educate you.
Absolutely.
She's going to take the time to explain what's going on and give you options. And again, the number one rule in this game is she's going to inform you enough for you to make an educated decision. Everything is on you. What you choose to do after that, after you're informed, it's on you what decisions you take from there. So I think Dr. Soyini is doing a great work. Again, Dr. Soy, tell him I'm sorry, I don't want to call you Dr. Soyini.
That's what everybody calls me. That's okay.
But tell them how they can find you again.
So getfibroidhelp.com will take you directly to my page. My practice is Fibroid and Pelvic Wellness of Georgia. And then on Facebook, www.Fibroid and Pelvic Wellness. And all of those will directly link you to me and my practice. My practice number is 770-475-4499. And any of that will get you in touch with me, even get you information or get you in touch with someone else that could be of help for you if you're not in the Atlanta area. And I take patients I'm doing a surgery next week on a young lady that's coming to flying from Canada. So if you need financial assistance, my hospital is phenomenal at offering financial assistance to patients. That's Northside Hospital. That's where I operate out of. So, we can get it done. We can get it done. You do not have to suffer or be in agony in silence. Okay.
And I think that she said that great, and we're coming to a close. I want to wrap up on the ladies do not suffer in silence. But fellas, do not let your lady, if you love your wife, you love your woman, you love your fiance, don't let her suffer in silence. She doesn't have to. There's people like that. There's so many out there, and again, I love her because she's just like me. If you're not working with somebody like us, if you're not working with us, work with somebody like us. As long as somebody's educated you so you don't have to suffer in pain or you don't have to suffer in silence, then that's what you need to do. So, again, Dr. Soy, I appreciate you taking the time out. I know getting back to school and everything, I had to take care of the boys. So I truly, actually being the first guest on my live show matters.
Yay!
Social media platform. So thank you very much.
Awesome. Thank you for having me. I enjoyed myself. This is what I love to do.
I was like, I can't hear it. Like, yay. No, it's my pleasure. Again, guys, we're going to save this up here. Go to her Facebook page. Go to her website. We're going to have this information up so you can share it with her. We love you guys. Thank you, Dr. Soyini. So you missed the website. One more time.
Sure. www.getfibroidhelp.com, or you can just Google search Dr. Soyini, Soyini, Hawkins, Hawkins, or even if you type fibroid and pelvic wellness, it'll pop right up.
Awesome. Well, here's the thing. Thank you, Dr. Soyini. It was my pleasure. I look forward to seeing you in OSA again. And again, this will not be the last time. I'll have you on again because I believe this is education.
Absolutely. You're going to have me my student loans, right? So I can keep taking care of these women.
See, here's what I'm going to I need everybody to go to Dr. Soyini's office, get her services, so she can make $1 million. No, I'm just joking. Yeah, definitely. And here's the thing, I wanted to say this, and I appreciate her saying that. Dr. Soyini is a client of mine. Her and her husband are clients of mine, and they trust me enough that they've entrusted me with their family. And they are the nicest people. I'm still trying to get on some lobster tail. We're gonna be pushing it front.
We got you, boo. We got you.
I know you do. And talk too much, but I gave her some great information and tie into this. I just want you to wrap up on this. When it comes to sanitary napkins, and you might be able to help or whatever the case may be, I think I sent you a video earlier and we talked about it. Inspired some of the things that I've invested in for my wife. Can sanitary napkins really be hurting women?
The thing is that here in the U.S., the FDA does not require companies to put in the ingredients in sanitary napkins. So just like the ingredients in synthetic hormones and some of the ingredients and some of the medications that we take, and I'm a medical physician, I have an MD, so I'm totally not against pharmaceutical companies and patients taking medicine. It's necessary, right? But we do not always know what is inside of some of those. And if you think about where we're placing them, and we're talking about the health, I don't know if I could say vaginal on live TV, but I just did. But we're talking about that health. The ingredients I just did. The ingredients they do make a difference. There's dyes in some of them. There's perfumes in some of them. All of those things can actually potentiate discharge, odor, itching, cramping, and pain and discomfort. So yeah, it does make a difference. It does. It absolutely can. And that is, when you sent me the link today, I was like, oh, I know all about this. That is, that's exciting because there are people out there that care enough and are inventing things that can be so helpful for women. And especially some of our young women. Think about teenagers that are, just starting to come into their womanhood and experiencing this. We want to give them the best. And so, we don't know yet if the best has been found, but I'm excited that someone is out there and working on that and trying to get better products out.
Well, I definitely agree. We have taken part in it only because, again, I have goddaughters. I have women in my life that I care about, so we took advantage of it. So we're doing this, Dr. Soyini. I know you said you've heard about it. I'm going to give you some for free, and all I ask you to do is just tell me what you think. How's that sound?
Absolutely. Absolutely.
Thank you very, very much. So, again, guys, please follow Dr. Soyini on Facebook. Please contact her, ladies. Do not suffer in silence. You don't have to do this anymore. And I just want to thank everybody, truly, truly want to thank everybody, because in Managing Money Matters, we talk about wealth. And you can't be wealthy if your health is not in order. You can't be. And so many women have fibroids or are suffering, and they have things going on, and they don't know who to talk to. That's why I felt it was important to get Dr. Soyini on the air, share on the platform so people can hear what she had to say. So for that, Dr. Soyini, thank you, and God bless you.
Thank you. God bless you too, Sean. I appreciate it. And say hi to your lovely wife.
I sure will. And you guys are listening to the Financial Lifestyle Planner, Sean Bailey, and Dr. Soyini Hawkins. We had a great evening. Don't forget to tune. We're going to do another show. You're getting blessed twice this week. We're doing another show Saturday morning at 9 o'clock with Claude Harris. We're going to be talking about the 3 asset classes of money. So tune in. So we love you guys. God bless, and we'll talk with you later.
Good night.